This video is a quick introduction to the proper positioning for a hand radiograph, PA, oblique, and lateral views. In order to successfully achieve this radiograph, you will be utilizing a 8x10 or a 10x12 image receptor as needed based on patient body habitus, which will be placed in a portrait view correctly on top of a tabletop. The image receptor should be 40 inches source to image distance. This will be the same across all three exams, being the PA, being the oblique, as well as the lateral views. Let's go ahead and have our instructors demonstrate how this exam should take place. Begin with placing a lead apron on the patient's lap and having the patient seated at the end of the table. Pronate hand with the palmar surface in contact with the image receptor and spread fingers slightly. Align the long axis of the hand and the forearm with the long axis of the image receptor and center the hand and wrist to the image receptor. Make sure that you place a letter marker to the medial part of the body part being examined within the light field. Center the ray perpendicular to the image receptor at the level of the third metacarpal joint. Align the long axis of the hand with the long axis of the image receptor and make sure that the tube has no angulation. Instruct the patient to sit still and not move while you make the exposure observing the patient. Once the exposure has been made, you may instruct the patient to relax and remove the image receptor from the exam room to process the image and acquire the radiographic image. You may enter the room with a new image receptor to proceed to the next view, which should be the hand oblique. In order to achieve the oblique hand examination, where the patient remains seated at the end of the table, pronate hand to the image receptor so that it is laterally rotated 45 degrees to the image receptor. The center of the hand should remain in the center of the image receptor. The long axis of the hand should be going along with the long axis of the image receptor as well, and make sure that there is no angulation of the tube. The marker should be placed medial to the body part within the light field. In order to successfully achieve the image, go ahead and instruct the patient to remain still and not move while you make the exposure observing the patient. After the exposure has been made, you may instruct the patient to relax and enter the room to remove the image receptor from the examination room. Process the image receptor in order to acquire the radiographic image and enter the room with a new image receptor. Now we are ready for our lateral view of the hand. In order to achieve this, ensure that the patient is seated at the end of the table and place the hand in a truly lateral position by rotating the hand and wrist so that the thumb is facing up. Spread fingers and thumb into a fan position, ensuring that all digits, including the thumb, are separated and parallel to the image receptor and that the metacarpals are not rotated but remained in a true lateral position. The center ray should be perpendicular to the image receptor, and you should be aligning the long axis of the hand with the long axis of the image receptor. Once again, make sure that the tube is not rotated and the marker is placed medial to the body part within the light field. Instruct the patient to sit still and not move while you take an exposure observing the patient. Once the exposure has been made, instruct the patient to relax while you enter the room and remove the image receptor from the examination table. After processing the image receptor to acquire the radiographic image, you have successfully completed your PA, your oblique, and your lateral examinations of the hand. Let's go ahead and see what these examinations should look like in a radiographic image. Here we have the position of the hand in a PA view. You should be able to see the metacarpals, the first, second, third, fourth, and fifth phalanges. You should be able to see the distal radius and the distal ulna. In an oblique view, you should be able to see the same as you saw in the previous image, except in a 45-degree angle. You should be able to see certain carpals superimposed among one another, as well as the head of the fifth metacarpal, the fourth, the third, the second, and the first metacarpal as well. Once again, you should be able to see the radius and the ulna in a 45-degree oblique view. In a truly lateral position of the hand, you should be able to see the metacarpal joints superimposed one above another, and you should be able to see the first, second, third, fourth, and fifth phalanges in a truly lateral position without any type of true superimposition among one another. If you fail to properly fan out the fingers, then you will have some type of superimposition, be that between the fourth and the fifth, the third and the fourth, the second and the third. There'll be something that will superimpose that will make this examination non-diagnostical. This completes the quick introduction to the proper positioning for a hand radiograph.